Hello, I'm Justin Moore, APTA's Vice President of Public Policy here at the State Payment and Policy Forum in Seattle, Washington. Today's keynote was Dr. Mark McClellan. Dr. McClellan currently is at the Brookings Institute doing a lot of work on healthcare reform implementation and payment reform. He was our keynote today. If there was one take-home message that you had for our members on payment reform, what would that message be?
Justin, it's really good to be here with you all. There is a lot of activity taking place that APTA has helped lead in reforming our healthcare system. The one message that I'd like the members to take away is that what they are doing in rehabilitative services can be a model and can have an impact on overall healthcare reform. In healthcare reform, we're moving from a focus on specific providers and specific fee-for-service payment systems towards payment systems and policies that support each patient getting the best overall care at the lowest overall cost. Physical therapists are right there with the patient, and I think healthcare providers, clinicians that are closest to the patient have a big role to play in the future of healthcare reform. So think about not just physical therapy in its own right and how important that is, but how physical therapy can help contribute to a reformed healthcare system that gets to better outcomes and lower overall costs for patients.
Great. One of the key things that I thought you had in your message was just the importance of patient-centeredness and how really real reform is going to happen when we put the patient at the center of payment models of innovation. As physical therapists in multiple settings, home health, hospitals, small independent practices, look at the future of payment and payment reform, how do they prepare for a patient-centered payment system?
APTA has already taken steps towards what a payment reform system that envisions and supports person-centered care would look like by proposing moving away from payments that are based on time spent with the patient and the like towards a payment system that's based on patient needs and the intensity of care that a patient might require, giving a lot more flexibility perhaps in how those services are provided. I'd encourage looking one step beyond that. How could physical therapy payment include a component that's based on the overall costs and outcomes of a whole episode of care for a patient? So for the hospitals and the physicians that are now moving into bundled payment reforms for, say, a joint replacement operation or bundled payments for a bypass surgery operation, how can physical therapists be part of that overall payment system directly? Wouldn't necessarily be most of the payment that physical therapists receive. Could start out as a shared saving component or maybe a PMPM component, just like other providers are starting to move to. That'd be one step. Another step is thinking about how to integrate with ACOs, where the providers there, whether it's a physician group or a hospital system or the like, are being held accountable for the overall costs and outcomes for a population. So once again, a shared saving component of reimbursement or a way of showing these providers that are trying to move towards lower overall costs and better outcomes, how you, as the physical therapy component of services, can help get overall costs down and improve outcomes for the patients.
Yeah, I thought your message was really well received today. It was the message of patient engagement and showing outcomes was just very consistent with what physical therapists do. We're all about function. We're all about engaging our patients in the help of their rehab. And so I thought your message was just right on target for that. You had a great policy career and continue to have a great, one of the thought leaders in healthcare. If physical therapists are out there following healthcare and what's coming down the pike, who are other thought leaders that you think are really out there leading health policy today?
Well, one thing that APTA really puts an emphasis on, especially the people that are here for this conference, is what's going on at the state level. So there's a lot of talk in healthcare about moving towards more person-centered care. This is one of those things that's a lot easier, Justin, to talk about than it is to actually do. When you start moving around the payments and changing the regulations, that brings out a lot of contention, a lot of people getting nervous about the way they're doing the work and the way that they're supported changing. So working with state leaders, so a number of governors around the country in states like Massachusetts and Wisconsin, both Republican and Democratic states have implemented reforms. I encourage working closely with them. And in terms of a vision for the future, groups like the Institute for Healthcare Improvement have done a lot of good work. But I would emphasize that it's not just about reforming care. Got to look at the payments at the same time. Just trying to find a better way to deliver care and hoping that it's going to be financially sustainable, that's not a business model. You have to change the payments. So keep looking at practical applications of the principles that I've talked about today.
And one final question. As clinicians, physical therapists, as an internist yourself, why is it important for clinicians to be engaged in the policy process, whether it's volunteer or whether it's like a career path like you and I have chosen?
Well, clinicians really are the future of healthcare reform. In this country, people do not trust the government about healthcare reform. They do not trust their insurance company about healthcare reform. They trust the clinicians who are closest to them. So any successful models for really reforming healthcare, keeping people healthier, changing the way that care is delivered, going to have to be led by clinicians. And not only that, physical therapists are really front and center in this effort because we're moving towards care that is less focused on institutions, less focused on spending a lot of time in a specialist office, and more. This is just where technology is headed generally. More convenience, more care at home, more care that's individualized to you. And the providers who are going to have the best chance to lead that are the ones who are closest to the patient. And nobody these days, Justin, is probably spending more time with patients, at least those with serious chronic illnesses and functional impairments, than people involved in physical therapy.
This is Justin Moore from the State Government Affairs Forum, and I think your message was just fabulous, that there's a role for everyone in healthcare. And those who show outcomes, who engage their patients, are going to be part of our future. And I think our members really felt reassured by that message, and thank you for participating.
Well, great to be with you, and thanks for all you're doing for Americans with health problems.
Thank you.